Hi there, my name is Beth Wills, and this is the wound assessment video. I just want to say before I start the procedure, what I'm going to do is do some hand hygiene, check the physician's orders, and we'll do all that and we'll get started. So here we go. Okay, so I did some hand hygiene here. Before we go into the patient's room, we're going to look at our physician's orders here. We have our physician's orders and we have the patient identifiers. We're going to look at the physician's orders. The patient's name is Vic Sear. His unit number is 006745. His date of birth is December 2nd, 1967. His doctor is Dr. Carlson. He has allergies to Tylenol. It gives him hives. He has a query of a diagnosis of diabetes and a query staph infection. And the physician orders say to cleanse, irrigate, and pack the wound using normal saline once a day and as necessary, or PRN, or as needed. To pack the wound using normal saline soaked 1/2 inch packing strips. He's allowed activity as tolerated, and we're to assess his vital signs every 8 hours. So I'm going to do some more hand hygiene, walk into the room, introduce myself to the patient, and then we'll get started. So I'm doing hand hygiene again, knocking on the door and walking in. Hello, Mr. Sear. My name is Beth, and I'll be your LPN today. We are going to do a procedure where we're going to take the old packing from your wound and pack it with some new packing. But before we get started, I'd like to check your identifiers, please. So can you please tell me your first and last name? Okay, it's Vic Sear, great. And Mr. Sear, can you give me your date of birth? Okay, great. It's December 2nd, 1967. Great, okay. And can you tell me your doctor? Dr. Carlson. Okay, wonderful. And also your unit number is 006745. Great. Okay, good. Mr. Sear, do you have any allergies that you know of? I noticed we have an allergy here. Yes, to Tylenol number 3. Okay. And what kind of reaction does it give you when you have this allergy? It gives you hives? Okay, well, I'll assure you we're not going to give you any Tylenol 3 today or any time at all for that. In addition to those allergies, I just wanted to ask you, do you have any allergies to tape or latex, gloves, any other allergies whatsoever that you know of? No? Okay, that's great. Just before we get started, I just wanted to ask you, have you ever had the wound packing procedure done before? Okay, great. And how did it go? Okay. Did you have any pain during the procedure? Okay. And everything went well? No questions about the procedure we're going to do, and no clarification needed? Okay, great. I'm also going to do a little bit of patient teaching about what we should look out for after we have finished the procedure in terms of, signs of infection. So you want to look out for any redness, coldness, puffiness, purulent discharge, anything like that, and just let us know and ring the call bell if you see anything like that. Also, just before we get going, I just want to know where your pain is right now. Are you having any pain? 0 is no pain, and 10 is pain that's out of this world. Can you rate your pain for me? Okay, it's about a 2. Great, yeah. We want your pain to stay at about a 2 or a 3. But if during any time during the procedure or after the procedure, if your pain increases, please let me know, and we will give you some medication to reduce your pain because it's important that your pain not get out of control. Okay, great. So just before we get going, Mr. Sear, do you have any questions about the procedure at all? Okay, great. Okay, so the first thing I'm going to do is I'm going to do some hand hygiene here. And I am going to put on some clean gloves. gloves are a little small. Okay. Okay, great. Okay, and the second thing I'm going to do is I'm actually going to take Mr. Sears' old dressing off. Now when I take his old dressing off, what I'm going to do is I'm going to look for any signs of discharge on the old dressing, such as the type, the amount, the consistency, or the odor of the dressing. Okay. So the other thing I'm going to do is I'm just going to open the dressing away from Mr. Sear. This reduces any chance of cross-contamination for infection, and also it does not shock the patient. So we have taken Mr. Sear's dressing off here. We're just going to loosen it up gently. Okay, great. Okay, so we're looking again at any signs of drainage, the type of the drainage, the amount of the drainage, the color of the drainage, or the odor of the drainage. Okay, all right, so we don't see any of that, so we can just put that in our garbage. Okay, so what we're going to do right now at this moment is we're going to look at Mr. Sear's wound. We are looking for any areas of maceration, any edema, any redness, any purulent drainage, anything like that. We're also going to observe the size of the wound, the length of the wound. We can see that obviously Mr. Sear has some packing inside the wound, and we can just look at all of this and we can observe, and that's great. Okay, so the other thing we are going to do is we're just going to touch around the healing edge, and while we're doing this, healing ridge, sorry, we're feeling the temperature of the skin as well. Okay, so we've done all that. That is great, and we have observed that he has some packing, and so that is wonderful. Okay, so the next thing we're going to do is we're going to remove the old gloves here. We're going to do some more hand hygiene here. Okay, and then what we're going to do is we are going to go ahead and set up our sterile field. Okay, great. So the first thing that we're going to do is we're going to look at our tray here. We're going to inspect the tray and make sure there's no breaks in the tray. The tray's intact. The tray is not expired, which it isn't. The tray looks good. The tray looks wonderful. Nothing wrong with the tray at all. So that's a good thing. So that is wonderful. So what we are going to do is we are going to open the tray. We're going to open the tray away from us. And the reason why we open the tray away from us is obviously we want to maintain sterility. So we're just going to open the tray here. Again, maintaining sterility, opening it away from us. Okay, great. Now, as you can see here, hopefully from the video, I will move out of the way just so that you can see. You can see that the green forceps were lucky. They're on top of the drape. If they were not on top of the drape, what we would have to do is we would have to ring the call bell, ask our coworker to come in, get us another set of green forceps, and not do the procedure. But as you can see, our green forceps are here, so it looks like everything is okay. Okay, so we're just going to move the tray over here a little bit. Okay, so we can pick up these green forceps. Okay, when we pick up the forceps, anything from the teeth up is the sterile part, and anything from the teeth down is not. So we can touch the forceps as long as we don't touch them from the teeth up. Okay, so the first thing we're going to do is we are going to take out one of our drapes here. Very carefully take out one of our drapes. Okay, great. And after we take out the drape, we can basically touch the drape, but we can only touch the 1-inch margin of the drape. So we're touching the drape right here. Okay, and we have opened the drape, and we're just touching around the 1-inch margin of the drape. Okay. Okay. Just going to reposition here. We don't want anything touching our sterile field whatsoever. Okay, great. Okay. So again, we have this 1-inch border. We can move the drape a little bit here. So there is a 1-inch border around this sterile field, meaning that everything inside of the 1-inch border is sterile and everything outside of the 1-inch border is not. So we can basically place our forceps here. We want to ensure that they are well within the 1-inch border and not outside. So here we have our sterile field, and again, maintaining 1-inch border. We don't want to do anything else with that. Okay, so we can pick up our forceps again, keeping the tips down. There's an extra drape in here that we don't really need, so we can put it high and throw it in the garbage. Okay, so we have some things in here that we can take out of our sterile field. We can take out our forceps here. Okay, and we can put them on our sterile field. Okay, great. We can take out a garbage bag here. And we can put this outside of our field. Okay. Okay. We can take out our 4x4 here and place it inside of the field. And again, we're putting our tips here, so that's great. And everything is okay right now. So that's wonderful. So what we can do is we can now open our garbage. We want to keep our garbage as close to our patient as we can. Okay, so we can just put the garbage over here. Okay, then I would do some more hand hygiene. So I'm doing some more hand hygiene. Okay, so now what we can do is we can start to open the supplies that we need and place them on our sterile field. Okay, great. So the first thing I'm going to do is I'm just going to move down here. And we have some 2x2s, some 4x4s, and all the materials we need necessary for our sterile field. So I'm just going to start. So we can open our syringe here. So keeping in mind when you open the syringe, you want to maintain sterility. So it should be able to peel like a banana here, and sure enough it does. So I'm going to move out of the way so you can see this. I'm peeling it like a banana. I am not touching the inside. I am now picking up my forceps and I am taking this out of the package and I'm dropping it in my sterile field. I'm putting my forceps down, and this I can put in the garbage. Okay. Similarly, I'm going to do the same thing with the catheter tip. Again, as you can see, I'm peeling it like a banana. I'm not touching the inside of the package at all. As you can see, I'm pulling the package down. Then I'm going to pick up my forceps again, and I'm just going to take this out, if it will cooperate. And it will. And I can also place that in my sterile field, again, putting the tips down, and this can go in the garbage. We can also open our sterile scissors, similarly in the same way. Also, I'm not putting my back to the field. You should never put your back to the sterile field at all. And I'm not. I'm just kind of turning around so you can see the camera angle here. So hopefully you can. And again, I'm just going to open my sterile scissors, maintaining sterility, pick up my green forceps, and I can also put those in my sterile field again, and this can go in the garbage. I can open up some 2x2s here, and these I can peel like a banana. Again, I'll show the camera here. I'm peeling it like a banana. I am not touching the inside at all. I am picking up my forceps, tips down, and I am pulling them out of the package and also placing them on my sterile field, and this can go in the garbage. Similarly, just in case I need another 2x2, I have that as well. So again, trying to show the camera here. I'm not putting my back to the sterile field. I'm just trying to show you in the camera what I'm doing. So that's why I'm sort of turning my body. Okay, so I would, again, open this, just not touching the inside, take my forceps, take it out, put it on my sterile field, lay my forceps back down, garbage. The ABD pad will leave for later. The sterile gloves will leave for later. We've already opened a couple of 2x2s there. I'll just open another one just in case. These unfortunately are the bad ones, the package. So again, I would tear open the package. I would take my forceps. I would reach into the inside of the package, maintaining sterility. Again, put it down, and this would go in the garbage. Okay, the next thing I would do is I would open my packing. Again, I'm maintaining sterility. I'm not touching the cap. I'm putting the cap outside of the sterile field, and I'm placing the packing gently down in the sterile field. Okay. The last thing I can do is I can look at my saline. I can make sure it's not expired. It isn't. It's a brand new saline, and I put the label to me. It hasn't been opened. It looks great. So we can actually take the saline, maintaining the sterility, and we can fill the wells of the tray. Okay, there we go. Great. And once we're finished with our saline, we can get rid of that. Okay. The next thing I am going to do is I am going to check to make sure everything's in my sterile field. We are all good. Life is good. And so I'm just going to clean my hands one more time. I'm going to put on the clean gloves. So we've done our hand hygiene. We're putting on the clean gloves. Okay. And what we're going to do is we're going to take our forceps and we're going to take the old packing out. So keeping in mind that we are not, we're not touching the wound at all. We're just taking the packing out of the wound. So very gently. Okay, we're going to get rid of the packing and the forceps and the gloves. Okay, they can go in the garbage. Okay, so the next thing I'm going to do is I'm going to do some hand hygiene, and I'm going to put on my sterile gloves. But before that, I'm just going to move some things out of the way here, so we have room to do our sterile gloves. Again, not putting my back on my sterile field at all. Just trying to leave some room here, not touching the cap. Okay, great. Okay, so I'm trying not to put my back to the camera here or my sterile field. We are going to open the gloves. So the first thing we can do is we can open the package. And again, this is garbage. Okay, so we can put this in the garbage. I'm not putting my back to the sterile field. I'm just trying to do this so you can see the camera angle. And again, what I'll do is I'm just gonna move this stuff way over here to try to give myself, again, not touching the cap, enough room to put on these gloves. Okay, so I'm only doing this for ease of seeing because I know you want to see the sterile gloves. So I'm going to very gently open up the package here. So hopefully you can see this. Again, not putting my back to the sterile field, just doing this for ease. I'm going to bend it back. I'm going to take the ends and I'm also going to bend those back as well. So I'm bending back the bottom of the package. So I'm bending it back here and I'm making a crease, only touching the bottom here, making a crease in the package. Similarly, I can do the same thing for the top. I can also bend the top back, which again I'm doing as well. So hopefully this is being caught on the camera because I'm, trying very hard for you to do that, which is why I'm saying I don't have my back to the sterile field. Okay. Okay, the next thing that we want to do is we want to be very careful with these. We want to ensure that when we open these, and I'm just going to turn myself around here so you can see, we're going to ensure when I open these that we're not touching anything on the inside at all. So we're just going to put our fingers underneath the flap here. Okay, and we can touch the little bit of the outside here. So we're going to very carefully open our gloves. Okay, not touching anything, just pulling. Okay, so now we have our sterile gloves. And as you can see, it's a little bit interesting. We're going to go for it. So we're actually not going to touch the outside of the glove. What we're going to do is we're just going to pinch the outside of the glove here, if I can get it in my hand. Okay. We are going to put our finger inside of the glove, which we can do. Okay. And we can ease our hand in here. Again, I'm not touching. I hope you can see this. I'm putting my fingers inside, but I am not touching the outside of the glove whatsoever. Okay, so I'm allowed to touch the inside, so I can pull the glove down. Allowed to touch the inside, so I'm pulling the glove down again. Okay, so obviously this is not optimal. We don't want this, but the good news is once we do this, we can touch the other glove. And again, I'm just going to pull this down a little bit more here. Okay, we can touch the other glove, and that's okay. So I'm just going to pick up the other glove now. Okay, and I'm going to open it. Try to open it here. And again, I'm putting my hand, again, not touching the outside of the glove, putting my hand very carefully into the glove. Sorry, I didn't mean to touch my shirt there. If I did touch my shirt, then obviously I'd have to start all over again and get a new pair of gloves. Not sure if I did or not, a little nervous, but if I did, sorry about that. Okay, so now what we can do is we can try to get our fingers here in the gloves. We can kind of wiggle them around because we now have the gloves on. Okay. All right. So we can do this. We can try to get this glove on as well. Okay. We'll see if we can fix it here. Okay. Okay, there we go. We're getting there. This one's looking better. Okay. 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 Okay, we're getting there with this glove. This is a good thing. Okay, now let's see if we can get here with this glove. Okay. I'm just gonna try to move this glove around very carefully and see if we can get our thumb in there. Again, I'm not touching my shirt. I'm sorry if I am. I am just trying to ease my thumb into the thumb hole here. Again, you can see this on the camera, I'm sure. Okay, so we broke the glove, but for all intensive purposes, since I don't have another pair of sterile gloves, unfortunately, we will have to imagine that these are the sterile gloves. So the only reason I'm stopping the camera is because I'm going to put another pair of gloves on. So, you know, that's my sterile gloves, but just let me get another pair of gloves because obviously I can't work with whole gloves. If this has happened in real life, we would get another set of gloves and do the same thing. Okay, so that's the donning of the gloves. So I'm just going to shut the video off for 2 seconds so I can get another pair of gloves. So just 1 second, okay? Because I can't work like this. Okay, thank you. Okay, sorry about the break. We're back with other gloves. So sorry about that. Okay, so back to our sterile field. So here we are with our sterile field. We have to keep our hands above our waist now because we're completely sterile. So we're going to do that. Okay, so the next thing that we're going to do is we can reach in our sterile field now because we're sterile as well. We can kind of move things around, which I'm going to do because I'm looking for 2 particular things. I'm looking for the syringe and I'm looking for the catheter tip. Okay. Okay, great. Okay, so what we're going to do is we're going to imagine, again, above the waist, we're going to imagine that we're drawing up saline. So just imagine that we're drawing up saline here. Okay. Okay, and once we get the saline drawn up, we're going to hit it for bubbles. Make sure there's no bubbles in it. Okay, great. No bubbles. And then we're going to take our catheter tip and we're going to attach it. And so here we go. So again, before we cleanse the area, we're just going to look at the wound again. We know the length, we know the state of the wound, we know we're going to have to do some packing to it, and we know that it needs to be cleaned. So we're just going to clean it with the catheter tip. So what we would do with this is we would clean it in a back and forth motion like this within an inch margin. So we would do this until the saline runs clean, and once we had it cleaned once, again, high, we would put that in the garbage. Okay, so the next thing we can do is we can now measure our packing, and this should be about the same length as what we took out, so we can, you know, kind of guesstimate how long that is. It can be about 4 forceps in length. So we're just going to cut our packing here now, again maintaining the 1-inch sterile border, and these scissors have a cap on them, so we're going to take that off. Okay, we can put our scissors down and we can just put our packing into the normal saline like such. Okay, So the next thing that we're going to do is, before we start our procedure, we are going to cleanse the area around the wound. So basically we can do that with our forceps and some 2x2s. Okay. So we're just going to rinse out the 2x2s, keeping the tips down again. Okay, you can just put that in our tray. So we're going to go top, inside, one swipe, garbage. Take another one here. Again, keeping our tips down. Sorry, I think we have two here. So I'm just, yeah, we did. I'm just trying to separate them. Okay. And again, we can go around the top, a 1-inch margin, and garbage. And that should be high, and it should, you should do that high. Okay, the next thing we're going to do is we'll do the bottom, one swipe and garbage. And again, we'll do the inch around, 1 inch garbage. Okay, so the next thing we can do is we can dry the wound. So we can either use our 2x2s, but these are dry because we have not put them in saline. So one swipe for the drying. Okay, and another swipe for the drying. Okay, the wound is cleansed, the wound is dry, and so now what we can do is we can actually pack the wound. Okay, so for the wound packing, what we're going to do is we're going to take our packing here, and I'm just going to move so the camera can see. We're going to take our packing, and we're going to get rid of excess fluid here. So try to get rid of all the excess normal saline. I'm just going to wring it out here. Okay, excess saline. Okay, so once we've done that, we can actually put it in our hand here, and we can just kind of, once it's in our hand, we can sort of do what we want with it. And I'm just going to get it ready here. Okay, great. Okay, so I'm going to move out of the way. So, and I'm going to talk about what I'm doing. So basically what we're doing when we're packing the wound is we're keeping our tips down. We're taking the end of this end here, and we're putting it in the wound. We are not touching, as you can see, I am not touching any of the area around the wound at all. And I'm doing this in an accordion fashion. Again, as you can see, I am not touching the outside. We are just packing the wound. My hand is not touching anywhere either, as you can tell. Not touching the wound. Just packing the wound, ensuring that the wound is packed well. Okay, not touching the wound, as you can see. I'm just going to move it out of here so you can see a little bit better. I am not touching the wound at all. I am just making sure the wound is packed. Okay. Okay. Again, not touching the outside of the area of the wound at all. Just packing the wound, ensuring that we are not touching the skin at all. Okay, so we're coming to the bottom, and we pack the wound, and we can just leave a tail like that outside of the wound. And the reason why we leave the tail is for somebody coming to change that. They know that we have done that. Okay, great. Okay, so the next thing that we can do is we can take our forceps and we can put a 2x2 on this. And I should say, I neglected to say, when we started the procedure, we should have pulled the curtain, we should have raised the bed and ensured the patient was safe before we started the procedure. I did do that, even though I didn't do that, and I'm aware that I should do that as well. So, okay, we're just going to take and put a 2x2 on this. Okay, all right, great. Once we put the 2x2 on the wound, the sterile procedure is over. We can actually either leave our gloves on or take them off. I prefer to take them off. I find for dexterity it's better. So I'm going to take them off. I'm going to do some hand hygiene here. And I'm going to go down to the table and I'm going to open up my ABD pad here. So again, maintaining sterility of the ABD pad. I'm going to take it out of the package very carefully here. Just touching the outside of the ABD pad. This can go in the garbage. Again, just touching the outside of the ABD pad. And we can kind of place it on the wound here. Okay, the next thing that we would do is we would take our tape and we're going to put 3 strips of tape on this to ensure it's affixed to the wound. So 1, 2. The other thing I should mention is during this procedure, what we should be doing is we should ask the patient if he's having any pain during the procedure, because, you know, if he is, we should medicate him, and we want to do that. So, okay, and then we're going to take a 3rd strip of tape, and we're just going to put it on the middle here. Okay, great. Okay, and finally what we're going to do is we're going to walk over here and we are going to put today's date, which is December, I think today is the 14th, I'm sorry, December 14th or whatever today's date would be, the time, and my initials. Okay, and what we're going to do is we're going to put this on the patient so that whoever comes knows when the dressing was last changed. So that is the end of the video. So like I said, what I forgot to do and I should have done is ensure that the call bell was, the patient's curtain was pulled and the bed rails were up before we started the procedure. At the end, before I leave, I'm going to make sure the call bell's in reach, the patient's comfortable, he has no issues and everything's okay. The other thing too I should mention is, ensuring that we have given him teaching about, what to look out for signs of infection, which we've done. We can also tell him about his diet and say that for wound care, it's better to have a high protein, high fluid diet because it promotes wound healing. And I'm just trying to think of any other patient teaching that we can do for him. We can tell him that the reason why we're packing and changing the wound was not only was it ordered, but it promotes healing from the inside out and faster healing. And that would be the end of my wound care video. Thank you very much.